Well, as the province continues to ramp up testing, there are fears about whether the labs will be able to keep up with demand. It expects to be even worse once elective surgeries begin. Joining us now to talk about the situation and its effect on worker morale is Hoad, CEO of Medical Laboratory Professionals Association of Ontario. Thank you so much for joining us today.
Good morning, Jamie.
So let's first off start off with the concerns about once elective surgeries start to resume. I mean, right now I'm guessing there's already such a high demand and it's only going to get worse once that starts to kick in.
Definitely. So right now in our labs, we have 6,300 medical lab technologists that deal with regular testing every day. So 500,000 lab tests done every day in Ontario. So when the pandemic started and the request for COVID-19 testing to happen, it's the same group of people that need to adapt to the testing. So they grabbed medical lab technologists, they've moved them over to the COVID-19 section, and they're doing testing. So what is going to start happening now is when those elective surgeries come back, or even the antibody testing that's going to start, all those tests are going to go to the same location where there's still the same number of people. So we anticipate we're going to start running into some issues.
Let's talk about morale. Lab management states that over 91% of staff morale is low due to not being included in the temporary pandemic pay. I know this has been a big issue for many people working in the labs. What's the latest there? What can you tell us about that?
Well, we have, as I discussed last week, been talking to the government quite regularly every day to make sure that we get included. That discussion is still open, which is great. But what has resulted in that is now we have lab professionals, medical lab technologists, medical lab assistants who are actually feeling unappreciated. And I think it's the concept that we are in the middle of a pandemic. We're dealing with a virus that is actually managed and tested by lab professionals, and they're not being recognized, and now they're not feeling appreciated. So we ran a survey this week. We've had tremendous feedback in this survey. 91% now are stating that the morale is very low in the lab. It's getting really, really hard.
I understand that roughly 60% of labs started the pandemic short-staffed, and roughly about 31% of these labs are saying that they're testing positive for COVID-19 has affected the staffing there. So when you factor in elective surgeries, people getting who have to take off work because they're infected with COVID-19, what are you anticipating for some of these labs?
I think the anticipation I have is, first, lab professionals are professionals. So they're going to come into work every day. They're going to determine how they're going to schedule their shifts to try to meet the demand. What we want the public to be aware is that we will definitely run into some sort of issue eventually. You can't expect to meet 20,000 tests a day of COVID-19 testing. And as the Premier announced yesterday, anyone that has symptoms can now request to be tested. That's going to raise that demand. I think we need to be patient and understand that hitting those numbers may not be realistic.
What are some of your other concerns moving forward?
Well, the world of medical lab technology is very interesting. So when we started this pandemic, we started short-staffed. The other major issue we have right now is there's 5 programs in Ontario that offer the medical lab technology program. They all have wait lists. So it's not like we can actually go to a different group of people and say, let's grab them and let's have them start doing testing. It doesn't work that way. So we're dealing with one pocket of people that are experts in this field. My concern is we need to really start looking into the future of opening more spots up at the programs in Ontario and seeing if we can get more people interested in coming into the program, because as we know, this pandemic right now, they're stating could be anywhere from 12 months to 24 months. What's this going to look like in 24 months from now if we still have a huge demand of testing? And the other issue is we got 44% eligible to retire. So we don't want people leaving the profession that's going to leave us every day wondering, are our tests going to get done? Are we going to be waiting longer? It's not the environment we want to see.
We know the Premier has really put a lot of emphasis on testing, and we're also hearing from the opposition saying that, listen, not enough testing is being done. When people in the lab hear these kind of comments and the rhetoric coming from our politicians, how does that sit with people in the labs who are already understaffed and overwhelmed?
I think it's a group of professionals that are never ever seen. So when we go to the hospital, we see a doctor, we see a nurse, we never see a lab professional because they're in a lab that we never get to see them. And when they hear comments like that, they really are disappointed that there isn't more appreciation for this group of people that are working 24/7 to hit our numbers. They call them hidden heroes because they're located in an area of a hospital we never get to see. We'll see the lab assistant as they draw blood or take a specimen, but it's the technologist that no one ever sees. So to answer your question, I think they feel a little disappointed, and they're hoping that through the pandemic pay there's some sort of recognition. So our hopes are still that we're going to still keep working with Premier Ford with this problem.
And given that they, part of their responsibility is to draw blood, and I understand from COVID-infected patients, and to say that they're not front line, I'm guessing that doesn't sit well with many of these individuals.
It does not sit well. One of our survey questions was, do you consider yourself frontline? 93% responded yes. And the other question was, do you feel that you should be included in the pandemic pay? And a resounding 93% said yes. So from a lab perspective, they definitely should be included in that.
Michelle Hoad, we really appreciate your time, as always, CEO of Medical Laboratory Professionals Association of Ontario. Thank you so much for joining us this morning.
Thanks. Have a good day.